We have a new compound that we use. It's a new isotope. It's sodium fluoride that we use in PET scanning. Typically, PET scanning is performed with a glucose analog, fluorodeoxyglucose actually. But this sodium compound actually mimics one of the compounds that bone uses to repair itself, the hydroxyapatite crystal. It mimics a portion of that, so it goes very rapidly to bone and almost specifically to bone, and goes into areas of the bone where the bone's trying to repair itself. So it's much more sensitive and much more specific than a standard bone scan that we usually do in nuclear medicine. With a typical bone scan, a lot of times you can't tell whether a finding is cancer or secondary to trauma that the patient has forgotten about, or due to arthritis, because the resolution isn't there and it's a two-dimensional image. With a PET scanning, it's a three-dimensional image. It's paired with a CAT scan at the same time. Plus, the compound is so much more sensitive for bone changes than our usual compound that we're used to using. All of those things combined increase the sensitivity and the specificity for early bone metastases. We can immediately exclude whether activity that we're seeing is due to arthritis or due to a fracture or trauma. And not only that, we can see very, very small metastases much earlier than on a regular bone scan. Right now, patients that would be referred to us would come from physicians who are treating patients with any kind of cancer that would spread to the bone. The most common two that I would think of right off the bat would be prostate cancer and breast cancer. This would benefit people who live outstate, number one, because the smaller hospitals outstate have trouble having enough patient population to justify even having a mobile PET scanner to come out there even once a week. Also, with the sheer number of PET scans that we do and that we read routinely, our ability is pretty good, because all the radiologists here read a lot of PET scans, and so we have a large volume of experience. I think the state of the art of medicine in Lincoln is top notch.